Hi everyone. In my previous video on childhood ear infections, I discussed how ear infections happen and how they manifest in children. If you missed it, you can watch it by clicking on the link below. Today, I'll be discussing why ear infections are more common in children, how you can help your child cope with such an infection if they encounter one. Childhood is liable to any infection, as immunity is generally immature and develops gradually. But why are children more prone to ear infections than adults? From my last video, I hope you remember the eustachian tube that connects the throat to the ear. This tube is actually shorter and more horizontal in children than in adults. This makes it easier for bacteria or viruses to travel from the nose and the throat to the middle ear, leading to infections. Also, the eustachian tube is narrower in children than in adults. This means that it gets blocked more easily than a wider tube would be. Plus, children have an immature immune system. They get exposure to the world of germs either in their school or play areas with other children who are like them, having immature immune systems, making them good carriers for germs. Sometimes there may be a genetic relation to ear infections pertaining to inherited traits that make their eustachian tubes more prone to blockages. Now, coming over to the most important question. What should you do if your child has developed an ear infection? Now, taking care of your child is all there is to it. I'll share with you basic and simple advice to help your child through this painful experience. If you suspect an ear infection, immediately consult your healthcare provider for a proper diagnosis and treatment plan. They will look through your child's mouth and ear and prescribe treatment accordingly. The doctor may prescribe antibiotics along with some pain relief medicines. If your child is in pain, you can give them pain relief like paracetamol or ibuprofen medicines. You can also watch my video on the difference between paracetamol and ibuprofen and when and how to use them. If your child's doctor prescribes ear drops, use them properly. Have your child lie down with the affected ear facing the ceiling. Put the drops in and keep your child in the same position for a few minutes to allow the drops to be absorbed. Or you can place a cotton wool ball in the ear to keep the drops in the canal. Children with an outer ear infection should avoid swimming for 1 week to allow the infection to heal. Now, if your child has hearing troubles that don't improve in the weeks following a middle ear infection or continues to be irritable, go back to the doctor, as your child may have something what is called glue ear. Your child may sleep better at night if they are propped up on 2 or more pillows. Now, only do this if your child is old enough to use pillows. Please don't allow anyone to smoke in the home or around your child. Cigarette smoke has been shown to stop fluids from being able to drain from the eardrum. Most children outgrow middle ear problems, including glue ear, and have perfect and undamaged ears with normal hearing when they become older. So, ear infections usually tend to resolve within 1 to 2 weeks with proper treatment. I would say prevention is always better than cure. So, how can you prevent ear infections in your child? First thing, teach your child to adopt and practice good hygiene. Practices like hand washing, brushing teeth twice a day, and maintaining good oral hygiene. This will help prevent throat infections. Always try to prevent your child's smoke exposure by all means. Very important, you need to keep your child's vaccination up to date and never use cotton swabs to clean the ear. This can block the ear canal and even cause injury to the eardrum. Pay special attention to your child's throat infections and get them treated timely. For those who have newborn babies, keep your baby in an upright position while feeding your baby. That's it for today. If you like this video, don't forget to share it with your friends and family and make sure to subscribe to my channel.